Hi, this is Dr. Dean Kelaita, Local Health Officer for Calaveras County with a COVID-19 update for today, June 9th, 2020. As of today, California has confirmed 131,000 cases of COVID-19 throughout the state, with 4,653 deaths. Calaveras County, on the other hand, has confirmed 19 cases of COVID-19 infection with no deaths in our community. The 15th case of COVID-19 infection was reported on Tuesday, May 26th, in an older adult gentleman residing in the Valley Springs area of Calaveras County. He was admitted to a hospital intensive care unit where the sickest patients go in critical condition. Calaveras Public Health Department was able to assist the hospital and the hospital physicians caring for the patient in obtaining a life-saving drug called remdesivir for the treatment of very critically ill COVID-19 patients in the hospital setting. The individual subsequently improved and has been discharged from the hospital, recovered, and returned home. One thing that I'd like to emphasize about this particular case is the importance of us being able to obtain this drug through a particular process that the mutual aid system, which is activated in Calaveras County, is able to provide for us. And the mutual aid system for Calaveras County is contingent upon us having active a local health emergency in effect. There have been calls by some to rescind the local public health emergency order in Calaveras County. And this is a good example of the importance of maintaining that local health declaration until the pandemic stabilizes and subsides. That's not going to be for a while now. It's going to be a long summer for us, and this is going to drag into the remainder of the year and potentially into next year as well. The 16th case of COVID-19 infection was reported on Wednesday, June 3rd, also in an adult resident of our county, a female living in San Andreas. This case was reported to the Public Health Department and led to a public health contact investigation, a contact tracing investigation, which subsequently led to the diagnosis of an additional 2 cases of household members, household contacts to that case. That was an adult male gentleman and an infant. None of these cases among the identified contacts of the household members have subsequently required hospitalization, and none of those additional cases in the household members have led to the identification of additional cases around those 2. So that's a classic case of a public health intervention of contact tracing, contact investigation, quarantining, and isolation of positive or exposed persons to prevent transmission in the community. The infant was attending child care, and a investigation around the child care setting is also underway as well for the potential need for isolation or quarantine of individuals who may have had exposure to the child, for example, other infants in the daycare setting. No hospitalizations, as I said, have resulted from those additional cases. The most recent 19th case was identified through the new OptumServe test site at the Frogtown Calaveras County Fairgrounds in Angels Camp. This was identified on Friday, June 5th, also in an adult female, this time from the Angels Camp area. So a similar process. Calaveras Public Health staff is investigating the details around this most recent case in order to determine where the person may have gotten the illness from, who the potential sources of infection might be, and to quarantine and monitor any close contacts for the development of symptoms of COVID-19 infection. And that prevents further transmission to others in the community. Symptoms of COVID-19 infection, as you're probably aware, consist of fever and respiratory symptoms such as cough, chest congestion, loss of sense of smell, headache, similar symptoms such as that. As most of you are also aware, Calaveras County has applied for and has been granted something that's called a variance by the state of California. The variance counties are allowed to move into the more accelerated portion of stage 2 of the Governor of California, Gavin Newsom's 4-stage pandemic roadmap to reopening the state and the economy and all the business activities that have been affected by this. All the activities that have been suspended as part of what we generally refer to as community mitigation efforts that are designed to quell the outbreak and flatten the curve, which is what's happened, which is why California case activity has been better than a lot of other states because of the early implementation of those measures. Beginning Friday, June 12th, the state will begin to move into stage 3 of reopening, as long as the local health officer, myself, believes that the data at the local level in Calaveras County shows enough positive disease occurrence and that the healthcare system is able to support a potential influx of ill people, of COVID-19 illnesses into the hospital. So the healthcare system does not get overwhelmed. That's a big part of what we're trying to do by delaying the onset of new cases of COVID-19 infection, is to prevent the hospital and the healthcare system from becoming overwhelmed with sick people beyond their ability to care for them. So because of these relaxation of these measures, the following entities can reopen in various counties such as Calaveras County with modifications starting on this Friday, June 12th. So some of the activities that can start to resume at that time are going to be very important things to a lot of us. Schools and school-based programs, and that's going to be a big one in getting ready for the fall academic school year. Restaurants, which have already been allowed to have in-restaurant dining, as well as bars and wineries. That would include wine tasting and bar seating. Fitness centers and gyms, those are good for the health of all of us. Campgrounds, RV parks, and outdoor recreation facilities. And that would include public pools as well. Like a fitness center with a pool can open both, including the pool. Hotels, lodging, and short-term rentals will be able to resume again. However, there's going to be a need that we have to reconcile with the state's non-essential travel order, which is still in effect. So the state says that you're not supposed to travel for leisure activities, and yet we're getting word that we'll be allowed to resume short-term rentals and leisure stay, and we'll have to reconcile that. Day camps will be able to resume. That would exclude children activity sports camps like basketball camp or baseball camp, and overnight camping as well for the time being, again, until we can reconcile that ban on travel and leisure activity. Card rooms and satellite waging facilities, racetracks, and tribal-based gaming will be able to resume starting June 12th. Something that's important to some people, movie theaters will be able to resume activity with reduced capacity. film, TV, and music production. We don't have a lot of that in our community, but those activities will be able to resume again. Again, they'll have to follow office workspace guidelines that are released by the state as well. The guidance specific to the movie theaters is that the theaters will have to limit their capacity to 25% of their normal movie-going capacity and no more than 100 moviegoers if there was a large movie theater, for example. Professional sports will be able to resume without a live audience. That's an important distinction. And again, they must follow specific workplace and retail guidance that the state of California is issuing. Another activity that can resume is family entertainment centers. These are defined as, for example, bowling alleys, miniature golf, batting cages, arcades. Those kind of activities are lumped into that category. Another broad category is zoos, museums, galleries, and aquariums. Nail salons, I'm not totally sure why, but nail salons so far have been excluded from this next round of activities that can reopen again throughout California. And even though these activities are going to be able to resume on Friday the 12th, each one of those business activities and categories has very specific guidance, and that guidance describes all of the infection prevention activities that the businesses, the schools, and the other facilities are required to put into place to be allowed for those activities to happen safely and to prevent, again, the transmission of COVID-19 illness from person to person, especially now that we know more asymptomatic transmission of COVID-19 that's been occurring as well. If we get the section about leisure travel clarified, then it'll be possible to eliminate the only remaining local health officer order that's in effect for Calaveras County. That's the order that limits short-term lodging and vacation rentals. And once that order is rescinded, if it's no longer needed, because those activities are allowed to move forward, as soon as that's the case, then I will rescind that order, and there won't be any specific orders for Calaveras County still in effect other than the state guidelines. As pertaining to overnight camping and for allowing youth sports practices and games to start again, we're waiting for guidance to come from the state, and that should be coming most likely sometime within the next week. So for the time being, youth sports, practice, those activities are not being allowed to move forward quite yet. We'll have to watch certain metrics to see if disease activity is going to increase. And so we'll be following those metrics before, during, and after the resumption of these approved activities that are going to be starting back up again. And we'll continuously be monitoring them as we go forward. So some of these metrics are as follows. The average number of coronavirus tests per day is something that we're going to be watching as a measurement of how well we're being able to test people. So our goal is that on a 7-day running average, we want to be testing approximately 75 of our county residents daily. Currently, we're testing 79 people on average over the last 7 days. We want to look very closely at the case rate of new infections per 100,000 population every 14 days. So the goal for that metric is less than 12.5 cases. Currently, we're at 5 cases in that time frame. We want to see less than 8% of our tests being positive in a 7-day average. Right now, we're averaging 1% test positivity. Hospitalizations, we want to see less than a 10% increase in hospitalizations on a 3-day average. So we're going to be looking at that every 3 days. ICU bed availability, we want to see more than 20% of our ICU beds are available in case we're going to need them. And we want to see a ventilator availability of greater than 25%. So remember, ventilators are those machines that are necessary for people in hospitals with severely damaged lungs to be able to breathe and to survive the COVID-19 infection. So you can see these are rolling targets over time. And we're going to continue to base our decisions on reopening of the different sectors that are scheduled to be reopening, the reopening of the economy, and the reopening of society in general, including other institutions like schools, or whether we'll need to potentially pull back some of the things that are going to be opening again. Those community mitigation activities that have been so essential in flattening the curve and preventing progression of COVID-19 infection, those decisions are going to be informed by data and the best public health practice and the best public health science. And so this data is going to be continuously tracked, it's going to be continuously monitored, and it's going to be shared with the public so that everybody can see what we're measuring, how we're doing, and once the reinstitution of these activities is underway, we'll be able to monitor for those metrics to ensure that disease activity is not increasing, that the hospital is able to care for people that might become sick, that we have the capacity to test people, and we'll be able to know with certainty that these activities are happening safely and that we'll be able to continue to move forward for opening additional sectors of our society and economy. I want to reemphasize some basic points. There's currently no vaccine to prevent COVID-19 infection. The best protection against COVID-19 illness and to prevent disease recurrence in our community and among our families and individuals just continues to rely on the basics, and these messages are ones that I'm sure you've heard before. They're things like social distancing, physical distancing, staying at least 6 feet away and 6 feet apart from people outside your household. That's probably one of the most effective ways of preventing transmission from person to person, is keeping us apart from each other in physical space. Washing your hands with soap and water for at least 20 seconds. An alternative is to use a non-water-based hand sanitizer product with at least 60% isopropyl alcohol. Avoid touching your nose and mouth. That's a potential route for introducing COVID-19 into the respiratory tract. Cover your cough or sneeze with tissues or your elbow, not your hands. That's, again, shaking hands, touching surfaces is a way of potentially transmitting the virus into the respiratory tract. And wearing a face covering over your nose and mouth. And that protects others. So you see a lot of people walking around without face masks on. It's, I think, a good sign to others that you take their safety seriously. And it's a good courtesy. Imagine if you were the cashier of a business and you had people coming through all day long, one after another. When you see people wearing a mask, it's a sign to that person who's in an essential job and who's putting themselves out there in society and dealing with the public and helping you with your transaction, that you care about them and that you care about their health and you're doing something to help protect them. So all of us doing these things, these small things, there's a lot of power behind those. And those are the things that are probably some of the most effective things that we can do to prevent COVID-19 infection from recurring and from getting out of hand in our community, and allowing us to continue to open a lot of these activities that we're opening up again, but to do them safely. And we'll be continuing to monitor those metrics that I discussed to make sure that disease activity, that hospital capacity, that the ability to take care of ill people in our community remains strong. So thank you for your support, and we'll be able to continue to release more information on a regular basis to inform the public and those in our community. Thank you.
We're clear.